Welcome, everyone. This is Dr. Edward Kondrot, and thank you so much for joining me for this special webinar, Chelation and Other Detox Methods to Save Your Life. And this is a very important webinar because I'm feeling more and more that this is absolutely essential if you're interested in regaining your health and wellness. And for all of you that have taken time to tune into this webinar, I do have some special bonuses for you. An amazing discount on the upcoming Chelation conference, which is going to be held here in Florida. So if you're in the Florida area, or you have friends in this area, or you don't mind traveling, this is a phenomenal 3-day event that we're having, and you're going to get a really amazing discount. We also have a special on all our chelation products, those of you that have joined this webinar. And as a gift, I'll be sending you an ebook on chelation therapy and other detox methods to save your life. This is my recent book, and in fact, it's just hot off the press, and I'm holding it in my hand right now. And I think this is one of the better books that I've put together. Here are some facts. I think one thing that every person in America has in common is the overexposure to heavy metals in our environment. They are wreaking havoc on your health, problems with everything in your body, your brain, your heart, and your eyes. And the most effective way is to treat these heavy metal poisoning is through a natural process, which we refer to as chelation therapy. These are some of the diseases and conditions that have been related to heavy metals in our body: cancer, eye disease, cardiovascular disease, Alzheimer's, autism, brain damage, low thyroid, birth defects and deformities, and many, many other conditions. And over the years that I have practiced, I have found that most of patients that I see that have visual problems, cataracts, macular degeneration, glaucoma, do have a component of heavy metal toxicity. And removing these heavy metals are an extremely important part of therapy for patients. Every day we're exposed to a small amount of toxic elements, and this continually adds up over the years. A common question that I get, well, Dr. Kondrot, where did I get these heavy metals? Where did I get the lead? Where did I get the mercury? Well, we grew up in a time when we had leaded gasoline, leaded paint, and leaded pencils. And even though we're reducing those contaminants, there still is a lot of lead and toxins in the atmosphere that we breathe, and they're still present in the water. Also, many of you have mercury amalgams. The mercury is being leached into your body. And it's very interesting, especially with females. Lead is safely contained in the bones in your body. Then when you become postmenopausal, the bones become softer, and the lead is slowly leached out into your body. And that's one of the reasons why postmenopausal women have a much higher incidence of heart disease and cataracts and eye problems. Chelation comes from the Greek word meaning claw, and the chelating agent binds heavy metals in the body so that the heavy metal is not as toxic, and it decreases its physiological activity, and also it makes this metal soluble. So these heavy metals are locked into your body, and the only way that you can remove them is through a process called chelation. Now, an interesting fact, people will say to me, well, Dr. Kondrot, my body will naturally rid these heavy metals if I eat well and I drink plenty of water. Well, the fact is, the half-life of lead in your body is 99 years. That means it'll take your body 99 years to naturally remove half of your lead. So if you have 5 milligrams of lead in your body, 99 years later, you're going to have 2.5. So in other words, we need to do something to speed up this process. We have examples of chelating agents in nature, And in our body, chlorophyll is a chelate of magnesium, and hemoglobin is a chelate of iron. EDTA, ethylene diamine tetraacetic acid, is a synthetic amino acid capable of binding lead, cadmium, and other toxic metals, as well as calcium. And I want to make a comment about this because one of the fears is that, well, this chelating agent is going to remove my good minerals in my body. Well, it is true. It's going to remove the good minerals, but it has a much, much greater affinity for these heavy toxic metals. These heavy toxic metals are huge. They're 100 times larger than calcium and magnesium, so it has a greater affinity to the toxic. And here's a picture of EDTA. It's a large molecule. It's actually 4 vinegar molecules combined, and it shows it attacking and chelating heavy metal. Now, the chelating solution we use is more than just EDTA. It also has magnesium, vitamin C, B complex vitamins, and it's a special chelating solution that helps to replace some of the B complex vitamins. In addition, some ingredients are put into this to prevent phlebitis and irritation to the veins. So chelation therapy has primarily been used to detoxify heavy metals. It binds these metals, and then they are excreted in the urine. EDTA became an agent that was developed in Germany during World War II as a substitute for citric acid because the supplies were scarce, and it was used in World War II to remove toxins from the body, to remove caustic chemicals used in gas warfare and poisons. It was introduced to the United States in 1947, and in the 50s it was determined to be very effective for treating lead detoxification. And doctors observed that patients who underwent lead detoxification, these were people that worked in a paint manufacturing plant, when they underwent lead detoxification, their cardiovascular systems have improved. So this by chance observation began to pique the curiosity of many doctors, and they began using this to treat patients who had coronary artery disease. Now, right now, chelation therapy in coronary artery disease is a topic of much controversy, even though there have been many, many studies done in the literature proving that chelation can reduce the incidence of heart disease. It was decided by the national government to do a major trial called the TACT study, the TACT, the trial to assess chelation therapy. And the results of this study, I think, have put this controversy of chelation therapy to rest. And I'll be going into a little bit more detail about this. So how is it possible that chelation therapy can help remove plaque and reduce the incidence of coronary artery disease? Well, a major component of plaque is calcium. So 3 theories are that EDTA may break up this plaque. It also may act as a hormone or a biochemical modulator that sets the calcium free. And chelation therapy also reduces oxidative stress. And oxidative stress and inflammation are felt to be a cause of coronary artery disease. So these are the 3 theories on how chelation works. And you can see that a main component of the arteriosclerotic plaque is calcium. In addition, iron is a component too. So chelation, the EDTA removes the calcium and iron. It kind of cleans the artery, scrubs the artery to improve the blood flow. Now, my early exposure to chelation therapy, I published this in my book, Healing the Eye the Natural Way, Chapter 9, this book was published in the year 2000, and I talk about my Uncle Sonny. My Uncle Sonny is a dairy farmer in Pennsylvania, Western Pennsylvania, and he developed severe angina, chest pain, and he was evaluated by the local hospital, and they told him he needed triple bypass surgery, and the bill was going to be $150,000, and my uncle didn't have any insurance, and he called me up and said, Dr. Ed, have you heard of chelation? A couple of my friends here are receiving chelation for heart disease. I was told I need heart surgery, but I'd like to try this. Now, at this time, I had no knowledge about chelation, and I did some quick research, and I told my uncle that I really didn't think that it would hurt him and just give it a try. So he underwent his chelation treatments, and all his chest pain went away, and he was able to be very active again working on the dairy farm. Now, the story gets really interesting because later on, he developed his chest pain again, but he had a good insurance policy. So he decided to have the open heart surgery. He had the open heart surgery, and after the operation, he still had the chest pain. And the doctors told him, well, the chest pain's psychological. You know, we replaced all of your arteries, and there's no reason for you to have the chest pain. So he went back and started the chelation therapy again, and his chest pain went away. So he was very angry. He felt that the open heart surgery really had no effect on his chest pain at all. My second exposure to chelation was a good friend of mine, Dr. Harold Bayer. I did my residency with Dr. Bayer at the Shea Eye Institute in Philadelphia. And I came across Harold at a meeting, and I found out he was doing chelation therapy. And I said, Harold, you're an eye surgeon. What are you doing chelation therapy for? He says, well, you know, I'm seeing a lot of patients with macular degeneration, and I don't seem to have a good treatment for it. But chelation is definitely turning around their vision. So that really got me interested in using chelation for macular degeneration. Then I came across an eye surgeon, Dr. Merle Lipton from Texas, who had advanced macular degeneration, and he had a dramatic improvement of his vision after he went through a series of chelation treatments. So this was my early introduction to chelation. So let's talk about the TAC study. This is a 10-year, $31 million study sponsored by the National Institute of Health. And the bottom line is heart disease improved 26%, diabetic heart disease improved 39%, and the heart attack rate decreased by 23%. So these studies, or these statistics, are really shocking. They're amazing, because if a drug had a decrease incidence of 10%, it would be a leading selling drug. And look here at the diabetic heart disease improved 39%. I think if you're a diabetic, the number one therapy that you should have would be chelation therapy. So this was a $30 million study. 100 sites were selected, and it was over a 5-year period. Now, it was really, really a good study because it was randomized, double-blind, placebo. What that means is they got a group of patients who they were high-risk cardiac patients. They either had a heart attack, they were taking cardiac medications, they had a stent. These were sick cardiac patients. They divided them into two groups. One group got chelation therapy, and the other group got sugar water. The doctors didn't know who was getting what, and the patients didn't know. So you were getting just a solution. You didn't know if it was active or not. And at the end of the 5-year period, they broke the code. So the goal of this study was to determine whether chelation or high-dose supplements in patients with heart disease did it reduce the incidence of cardiovascular events. So part of the placebo was they gave them vitamins, not the chelation, the vitamins. So I thought it was a very, very good study. Now, in this study, you may be asking me, well, Dr. Kondrot, what does this have to do with the eyes? Well, in this particular study, they did not look at macular degeneration or eye problems, but I can promise you just about every patient I have who goes through chelation therapy will have an improvement of vision. Now, will chelation therapy cure macular degeneration or glaucoma? No, it will not cure it, but I think it's one of the most effective procedures for improving your health, improving the blood flow to that particular organ, and reducing heavy metals, which are a contributing factor. So the TAC study was done because I mentioned the raging controversy. Does chelation help coronary artery disease? Chelation has been done for more than 40 years. And there's very strong components on both sides of the argument. Some doctors are just vehement that chelation does absolutely nothing, and the other camp of alternative doctors feel that chelation does everything. So it's kind of like our political system. The Democrats and Republicans are constantly arguing, and they have different points of view. So the National Institute of Health wanted to settle this controversy once and for all. Is chelation safe and effective? If the chelation therapy proved worthless, then people with coronary artery disease should stop wasting their time and money on this. So they decided to come up with this really good study. So the theory was that the most common form of heart disease is that these arteries get blocked and plaque develops. And the key component of the plaque is calcium, and less oxygen and nutrients reach the heart because of this plaque buildup. So if we can get rid of the plaque in a natural, non-surgical way, it should help reduce the incidence of heart disease. And heart disease is the most frequent cause of death in the United States. 7 million Americans suffer from coronary artery disease. More than 500,000 Americans die each year. So if we had a safe, natural, non-surgical method of reducing heart disease, that would be extremely, extremely valuable. As I mentioned, in the 50s, EDTA was found useful to treat lead poisoning. And they reasoned in the 50s that if EDTA could bind calcium, and calcium is in the arteries of the plaque, then EDTA could be used to treat coronary artery disease. Typically, this is done via an intravenous infusion giving over 3 hours. It's administered in a medical doctor's office once a week, and usually you need 30 to 50 treatments. I advise patients to sign up for 20, reevaluate after the 20 treatments, and then do an additional 20. It is important that you do continue what we call a maintenance chelation therapy. So after you get your 20 to 50 treatments done every week, that you do get a maintenance therapy once a month. And even though I do not have any heart disease, some of the studies that I have done on my vascular system indicates that I have early arteriosclerosis. So I'm getting a chelation treatment once a month here in the office just as a maintenance. One thing I have to emphasize that chelation is part of a total program that involves diet, supplements, exercise, stress management, and medication. So it just isn't a shortcut to health. This is part of a program. Chelation does deplete trace minerals, so these must be replaced with good diet and oral and IV minerals. But side effects are minimal when the ACAM protocol is followed, and the ACAM is the protocol that I follow. It's the American College of Advanced Medicine protocol. So chelation is a powerful antioxidant. It removes free radicals. Free radicals are elements that damage the tissue. It removes toxic minerals, as I mentioned, lead, cadmium, mercury, which contribute to coronary artery disease. It also removes soft tissue calcium. Now, one of the questions that I get, if it's going to remove calcium, isn't it going to weaken my bones? And this is especially a concern in ladies who are postmenopausal. Well, actually, studies have been done to show that chelation actually strengthens your bones. Now, you might say, now, how could this possibly occur? Well, chelation removes soft tissue calcium. This is calcium that is in the blood vessels. And when it removes the soft tissue calcium, it stimulates the parathyroid gland. And the parathyroid gland begins to store more calcium in the bone. So actually, some studies have shown that chelation therapy actually strengthens the bone, not weaken it. Now, the side effects of chelation are very few and not very serious. Some of the effects can be fever, low blood pressure, headache, nausea, and vomiting. The big one we're concerned with is injury to the kidneys. And because of this, we routinely get a serum creatinine. Serum creatinine is the measurement of kidney function. And when we know your serum creatinine levels, we make adjustments in the chelation protocol. We either give you less EDTA or we infuse it at a much slower rate. So that is important that you do have your serum creatinine measured. Now, in addition to the TAX study, there's been several other studies done. There was a Danish study, Brazilian. There was a meta-analysis review article by Dr. Schachter. And I'd like to briefly go over these. The Danish study looked at 470 patients, and 80 to 91% of these patients improved from baseline, their baseline parameters, and 58 out of the 65 did not need CABG, which is coronary artery bypass grafting, and 24 out of 27 did not need amputation. So it's a very, very effective treatment for treating decreased blood flow to the lower extremities in diabetics. A Brazilian study, phenomenal. The majority of patients, 98% peripheral cardiovascular showed marked or good, 93% coronary, and 60% cerebrovascular showed marked or good. So not only is EDTA good for the heart, peripheral, but it's also good for the brain, improving blood flow. And this was a review of 19 to 40 articles involving 22,000 patients measuring the effect of EDTA on cardiovascular disease. And there was a high positive relationship between EDTA therapy and improved cardiovascular function. So, the overview, historical background, and current status of EDTA chelation therapy for arteriosclerosis. This was another review article that showed that EDTA therapy does indeed improve cardiovascular. So let's get back to the TAX study. It involved 100 sites or more, and these were major university sites. So these weren't, Dr. Kondrot's office in Dade City. These were major universities like the University of Miami, UCLA, major sites. And it's interesting, too, because some of these sites were run by both chelation proponents and conventional cardiologists who were skeptical. So we had both sides, kind of like counting votes in our political system. We have both sides represented when you're counting the votes. It was 5-year randomized double-blind, as I mentioned. Patients didn't know what they were getting. Doctors didn't know. It tested the standard chelation solution against a placebo. And it also tested the effects of high-dose antioxidant, vitamin, and mineral supplement versus a placebo. So they wanted to see if just giving a person vitamins would reduce the incidence of coronary artery disease. So the goal was to see if chelation would reduce the incidence of cardiovascular events. So the total number of patients in this study, 2,372, half of them got chelation and half got placebo. And half in each group got oral vitamins and mineral supplements, and the other half just got a placebo with no vitamins. And all the participants received a single vitamin mineral containing trace minerals like zinc, manganese, copper, chromium, and B6 because of the concern that the EDTA does remove some of these minerals. So the results: heart disease improved 26%, phenomenal. Diabetic heart disease improved 39%. Heart attacks improved 23%. So these were high-risk cardiac patients. So in the diabetic subset, if you got the chelation therapy, you had a 39% reduction of having an additional cardiac event. Phenomenal, phenomenal. So, conclusion, I feel that the TAX study showed tremendous benefit for two reasons. One, it improved the vascular flow, and second, it removed heavy metals. And I feel that heavy metals are a contributing factor in all diseases. So in our office, we do a couple of tests. We do the oligoscan, which uses spectrophotometry to determine intracellular heavy metals. We also do a test called a 6-hour urine challenge test. This, I think, is probably the best way to determine if you have heavy metals. And you need a challenge. And what do I mean by a challenge? Well, you do take some pills, chelation pills, which make the metals more soluble. Then you collect your urine and measure. You could be dying of lead or mercury poisoning, and your blood and urine is going to be normal. So it's a big mistake that conventional doctors, when they measure you for heavy metals, they just check your urine and blood, and they go, nothing's there. Well, you need a chelating agent, and you need to collect it over 6 hours. So that's why we recommend a 6-hour urine challenge test. If you're listening out there and you haven't had a urine challenge test, I would highly recommend that you do get one. We also do a cytoelectrodermal testing. This is like a kind of kinesiology, which we measure subtle electrical signals in your body to determine if you have heavy metals. So all these things are things that we do in the office. So as I mentioned, the best way to evaluate heavy metals is by a urine challenge test, where you take a chelating agent, it binds the heavy metals that are locked in your bone, fat, and brain and eye, and make them more soluble to be excreted than they're measured. And here's an example of a 6-hour urine challenge test. And very commonly, you see the bar in the middle, lead. It extends across the page into the red zone or the danger zone. We also use the Zyto analysis for toxic heavy metals. And the Zyto test not only identifies heavy metals, but also pesticides, herbicides, mycotoxins, allergies, your hormonal imbalance, and immune function. So the Zyto test can be extremely valuable, and we do this routinely on everyone that comes into the office for the Kondrot program. Now, in addition to the chelation, I just wanted to talk a little bit about there's other ways of detoxifying your body. Good nutrition, proper hydration, infrared sauna, microcurrent can be helpful, homeopathy, and we already talked about chelation. Cilantro. Many alternative doctors feel that this is the greatest gift to mankind, cilantro. Cilantro is a very powerful chelating agent, and I would recommend that everyone here grows some cilantro on their windowsill and put cilantro in your soup and salad. There was a study done with Vietnamese people, and they found to have extremely low levels of mercury and heavy metals in their body. And the reason for this is the Vietnamese love to eat cilantro. There's tons of it in Vietnamese soup and other cooking that they do. And here's an example of a window cilantro. It's very easy to grow, and it can be one of the most powerful ways of detoxifying your body. Here's an example of an infrared sauna. The infrared sauna is very beneficial to removing pesticides and chemical toxins from the body. It's probably not that effective in removing heavy metals. It doesn't go deep into the body enough to remove the heavy metals. So you do need some type of chelating method. Homeopathy can be used. Homeopathic preparations have been shown to stimulate the body to detoxify and remove heavy metals. We have microcurrent frequencies that can also help remove heavy metals. Now, lastly, we already mentioned the chelation therapy. Intravenous is probably the best way if you have a high level of heavy metals in your body, but you can also do chelation rectally with rectal suppositories, topical, a cream, and oral pills. So many of you cannot have intravenous because you have poor veins or you don't live close to a doctor that does chelation, or there's also a cost factor involved. Intravenous is fairly expensive, but I feel that the intravenous treatment is probably one of the best investments that you can make in your health. The rectal suppository, only about 25% is absorbed rectally, but it can be very effective long term. Topical is ideal for children who cannot receive an IV or they're not able to take the oral pills. So usually what we recommend is that you do have everybody I feel needs some type of chelation therapy in order to help you stay healthy, and those of you that are having some health issues to regain your health. So I have worked on formulating a product, our ocular detox, and here's an example of me giving a lady an intravenous IV. And here's the product, detoxamine. On the left is the rectal suppository, and on the right, I formulated an ocular detox. It's not only good for the eye, but it's also good for the cardiovascular system. It has the EDTA and some key ingredients in it. Those of you that are listening and you're wondering if a doctor near you does chelation, one of the best sites to go to is the following, www.acam.org. This website has a list of doctors that are certified in doing chelation therapy. A great video that was released called Unleaded. If you're interested in watching a great video to really go into detail about the dangers of lead and the importance of doing chelation, I would highly recommend watching this video. We do sell the video at our office. In fact, those of you that stop by the office would be happy to play it for you. Now, let me back up here. Order my latest book for a 20% savings, but this is the hard copy. All of you that have attended this webinar, I am going to give you a complimentary copy. It's going to be an ebook. So what I'll do at the end of the webinar, I'll be sending you the PDF ebook so you can read the book. But if you are interested in getting a hardback copy, many of you are, we'll give that to you at a 20% savings. So I feel strongly all of you listening should begin chelation now. I am actively doing chelation on myself. Everybody that comes into the office, I recommend that they undergo some type of chelation program. Remove heavy metals, improve your cardiovascular function, improve mental functioning, and improve your eyesight. Remember, an ounce of prevention is worth a pound of cure. And I feel that chelation therapy is by far one of the best investments you can make in your health. So if you are local, I think that the oligo scan for heavy metals is a good way to help you make a decision regarding chelation. We also do something called a max pulse for cardiovascular health. This is an example of an oligo scan. It gives you a rundown of all your minerals, good minerals, and you can see this person has a low level of silicone and lithium, and then aluminum is very high in this heavy metal test, along with mercury. So the oligo scan is a nice screening device. We also do the max pulse, which determines the degree of arteriosclerotic vascular changes. We evaluate the arteriosclerotic changes from type 1 to type 7, and we give you the range that you're in, and then during chelation, we actually see an improvement of your vascular health, which is very, very positive. And here's an example of the correlation here. You can see the blockages of the blood vessels here in the center. As you go down that center column, you see more and more arteriosclerosis. And this is one way that we can very easily evaluate. So those of you that live near the office here in Florida, you're welcome to come by and get a complimentary max pulse test. Those of you that live outside of the state of Florida, I would contact one of the doctors on the ACAM website, acam.org, to get these tests done. Now, we are having an amazing 3-day event. It's the Chelation Therapy Conference. We have some of the top alternative doctors in the country here who are going to be presenting articles and discussions on chelation, and this is an opportunity for you to meet them, talk to them. So for a price of a doctor's visit, you can attend the entire weekend of lectures. You can meet doctors, talk to them, learn more about chelation, and begin to develop some type of good chelation program for yourself. So it's April 17th, 18th, and 19th at the Dolphin Beach Resort, which is it's a phenomenal location and very reasonable room rates, $119 a night at the Dolphin Beach Resort. These are some of the top speakers. Many of these speakers were involved with the tax study, so you'll not only hear them, you'll get a chance to talk to them and find out the best treatments and therapies for you. Also, we have a special patient workshop, Chelation 101, everything you need to know to have a successful chelation and detox program to improve your health. This is a great opportunity to meet and talk to doctors and find out what's the best program for you. So this is our special offer. This 3-day event, 2 days of educational talks, chance to mingle and ask questions. We have a special patient workshop. We have 2 lunches and a celebration dinner to honor the authors of the chelation book. And all of you listening to this webinar will get a free ebook of the chelation therapy and other vital detox methods. So the price for the 3-day event is $495. And for those of you, and this is only for patients, so if there's some doctors listening to this webinar, this is only for patients, because I feel so strongly that if you are a patient out there, you need to be educated in chelation. Our special discount is we're giving you a 50% discount, half off the normal. So you only have to pay $247. And this is a special offer. It's limited to the first 10 people who respond. So if you're living in Florida, I think it should be a no-brainer. Come to St. Pete's Beach and take advantage of this special offer. But if you live out of state, you may want to check some discount airlines and fly here for the weekend. And I promise you, you will not be disappointed. This is going to be an event that will change your life. And I do want to make this affordable for all of you that are listening. So give the office a call at 800-430-9328 or email me, and someone will get in touch with you. But we are offering this only for the first 10 people, and this is only for patients, not for doctors. And if you do sign up for the conference, we are going to give you 2 additional bonuses. I'll send you the unleaded DVD, which is a $24.95 value, and I'll send you a hard copy of the Chelation book. So this is something that the hard copy, I always like a hard copy better because you can pass it around to friends and take it with you, although I do have the Chelation on ebook also. We also are offering a special on chelation therapy in our office. The normal price for an IV chelation is $175, and we are offering a package of 20, only $110 each. So this is a savings of $1,300, and this also includes the creatinine and blood testing that you need. So those of you that are local in the area and are thinking about chelation, now's the time to take advantage of this. Give the office a call. These are our 2 products that I mentioned, detoxamine rectal suppositories and ocular detox and oral capsules. Basically, the price for the rectal suppository is $219. The oral capsules is $59.95. And this is probably good for about 2 months or 60 days. We have a special on the suppositories and ocular detox. I do recommend that you take these together, and 20% discount, so it's a savings of over $55. And this offer is only good until April 15th, and only 1 per order, so you can't order more than 1. We're also offering a special on the urine analysis for heavy metals. Usually it's $245. We're giving that a 20% discount. And this offer is only good until April 15th. April 15th is tax day. Many of you are going to be paying money. Well, everybody ends up paying money, so this is a good way to soften the blow of the April 15th tax day. So the summary is we'll have a lot of offers here for you. We have the IV package where you'll save $1,300. We have the 6-hour urine analysis. We have a discount on the detoxamine rectal suppositories and ocular detox oral capsules. And we have a 50% discount on the 3-day Chelation conference, April 17th, 18th, and 19th. So, and then all of you will be getting the book. I'll be sending that to you at the conclusion of the webinar, so look for that in your mailbox. So why am I doing this? Because I feel so strongly that everybody listening to this webinar should undergo some type of chelation therapy. It is essential for you to improve your health and ensure that you stay healthy. It's probably the best insurance that you can have. And that's one of the reasons why I am trying to make it more affordable for you. And I really hope that many of you will take advantage of this special discount on the Chelation conference. So what I'd like to do, I'd like to open it up for questions. And if you'd like to call the office to take advantage of some of these special bonuses and the Chelation conference, the number is 800-430-9328. That's 800-430-9328. Or you can just email us at info@healingtheeye. Question is, can you take pills or powder orally to detox? What is the best ones? Well, either pills or powder orally can be used to detox. And it depends on what you are detoxing for. And you also have to I believe, detox under a doctor's supervision, because sometimes if you're too aggressive with the detox, you can then develop problems. This is a very good question. Do you need to take the mercury out of your mouth before chelation? Well, the way I make this decision, if you get the 6-hour urine and your mercury is off the chart and you do have dental amalgams, then I would recommend that you get the amalgams removed. But if we do the 6-hour urine, you have mercury amalgams in your mouth, but the mercury is not elevated in your urine, then I think you don't have to remove the amalgams. It's very, very expensive to remove the mercury amalgams, and sometimes people get into more trouble when they remove the amalgams. Is a detox foot bath effective for chelation? That's a good question. I think the detox foot bath is excellent for removing chemicals and pesticides and some toxins from the body, but it's not that effective for removing heavy metals. To remove heavy metals, you do need a strong oral agent, or the best is IV chelation. Is chelation safe for diabetics on blood thinners and other medications? Absolutely yes. Chelation is extremely safe for diabetics on blood thinners. And if you are a diabetic, I would highly recommend that you do consider chelation therapy. It's probably one of the best things you can do. In diabetic, does chelation help with calcification in the abdominal aorta? Yes, it does. It removes calcium everywhere. The question is, do we check for creatinine clearance or blood creatinine? We do both. We check your blood creatinine and we extrapolate to see what the creatinine clearance is. Question is, are cilantro seeds, coriander effective for chelation? I don't think the cilantro seeds are what's effective. It's the cilantro plant. So you need to grow the seeds. And I may be wrong on this, but it's the actual plant that has the medicinal value and the chemicals. The seed does not have the chemical chelating agents like the plant does. If you have fatty liver, can you still do chelation? Yes, you can still do chelation with fatty liver. In fact, the chelation will help improve the blood flow and it'll help detoxify the liver. So yes, yes, indeed. Any other questions? Just write in the box there. Can you take a regular regime of supplements while chelating? Absolutely. We recommend that you continue your regular supplements while you're getting chelation therapy. And in most cases, we do recommend that you take an additional mineral supplement to make sure that your minerals do not become deficient. It's rare to become deficient in minerals while you're getting chelation, but we do recommend that you take this added step. The question is, can you talk for 1 minute about chelation and drusen? I have. Drusen is an accumulation of calcium and lipofuscin, which develops in the macula of the eye. And I have seen patients with long-term chelation have a reduction in the drusen. I think just about every eye patient I have that undergoes chelation therapy will notice an improvement of their vision. Can you experience pain from chelation? I've had pain afterwards, but was not sure what it was from. Well, it's important that you do have the chelation administered at a very slow rate. Also, most of the chelation mixtures have some procaine or anesthesia administered. But if the chelation therapy is properly administered, you should not have any pain or discomfort. What do you think of Dr. Shade's protocol for mercury testing? And I'm not familiar with Dr. Shade's protocol. There are many, many ways that you can test for mercury. We probably use 3 or 4 different methods in the office. As I mentioned, we do the oligoscan, which measures intracellular mercury. We also do the 6-hour urine test, and we also do the Zyto electrodermal test. So those are the 3 tests that we do. Hair analysis is another way that you can measure for mercury, but the hair analysis, I believe, is not as effective. And what about pushes? Well, chelation pushes are another way. It's a smaller amount of EDTA that goes into the body, although the pushes were not evaluated as thoroughly as the longer chelation that was tested with the Detox study. So a lot depends on you as an individual. In our office here in Florida, we give 2 types of chelation. We give the long TAC trial chelation, which is 3 hours. We also do a mini chelation, which is a shorter version. And some doctors feel that the mini version is just as effective as the long version. Well, I want to thank all of you for joining me, and I really hope you do take advantage of some of the special offers that we have. You can reach the office at 800-430-9328, 800-430-9328, and you can go to our website, Chelation2015.com. That's Chelation2015.com. So I want to thank everyone for attending, and I look forward to seeing many of you at the special Chelation conference, which is coming up April 17th, 18th, and 19th in St. Pete's Beach. Thanks, everyone.